Varicose vein, 11 treatment methods, causes and symptoms of this disease. Education about science and medicine prepared by editors of the channel All Scientifical. What are varicose veins? Varicose veins are a disorder in which prominent blue veins appear just under the skin. Of course, we are accustomed to the fact that varicose veins most often appear on the legs, but this disease can also affect other parts of the body, such as the stomach, chest, groin, intestines, and esophagus. How does the cardiovascular system work? Our body has a very interesting cardiovascular system. In order to transport oxygen to all tissue and organs from the heart to every part of the body, strong arteries are distributed, which are equipped with good muscles, but with veins everything is different. They use nearby muscles to direct blood back to the heart. How does a vein work? To prevent blood from returning, one-way valves operate inside the vein. When the valve opens, blood moves toward the heart. When closed, a barrier is created to prevent the blood from flowing back. Are superficial varicose veins dangerous? Although vein can be painful and unsightly, in general superficial varicose blood vessels are considered harmless. What happens if the veins become inflamed? When these veins become inflamed, they become sensitive to touch and can impede circulation, causing symptoms such as swelling, itchy skin, pain. How do varicose veins of internal veins manifest? In our lower extremities, in addition to superficial veins, there is also a developed internal venous system. In rare cases, varicose veins appear on the internal veins, causing pain through the entire affected limb. Due to their anatomical position, these blood vessels are more difficult to diagnose. Why are varicose veins of internal vein dangerous? Unfortunately, varicose vein can cause blood clots to form, inflammation of the internal blood vessels, thrombophlebitis, oophogenesis, increased the risk of pulmonary embolism, which is often fatal. Genetic predisposition to the appearance of varicose veins. Varicose veins are a very common disorder. Some people have a genetic predisposition to develop this disease. Women suffer from varicose veins twice as often as men. In Western countries, 20% of women and 10% of men suffer from varicose vein. Symptoms of varicose vein. The main symptoms of varicose vein are pain in the legs, sensitivity of the legs to touch, heaviness of legs, swelling of the lower extremity, especially after standing for a long time, prominent blood vessels of a bluish color at the level of the legs and thighs, indicating varicose vein of the superficial veins of the legs, changing skin color and texture, as well as skin ulcer and persistent pain. These symptoms may indicate an acute form of varicose vein. Pain and heaviness of the legs, sometimes accompanied by swelling, by without visible blood vessels in the legs, may indicate the presence of deep varicose veins. Symptoms of deep vein varicose vein. The presence of such signs indicate varicose vein of internal venous system, change in skin color around varicose vein, skin ulceration, constant pain without any special external signs. Attention, if you have deep varicose vein, it is recommended to consult a doctor immediately. When should you see a doctor for varicose vein? If there is increased swelling of the legs or if the skin of a lower extremity with varicose vein change color, texture, ulcer or there is a risk of bleeding, your doctor may recommend removing varicose vein to relieve discomfort and prevent cardiovascular complication. In case of accidental or intentional cutting of varicose vein, stop the bleeding and call a doctor. For varicose vein of red color, this sign may indicate the presence of phlebitis. The main causes of varicose vein on the legs. The main causes of varicose vein are pregnancy, excess weight, standing on your feet for a long time, passive lifestyle, chronic constipation, age, and tumors less often. It has been observed that sitting on a chair with crossed legs does not lead to appearance of varicose vein, but may aggravate an existing disorder. Does chronic high blood pressure affect the development of varicose vein? Varicose veins are a consequence of chronic high blood pressure, which dilates the veins. When all of these blood vessels move too far away from each other, the valves begin malformation. Thus, blood has a harder time reducing to the heart and tends to pool in the veins. This increases the congestion of the venous system and leads to the appearance of prominent blue varicose vein. Why is the risk of varicose vein higher in superficial veins than in deep vein? The likelihood of varicose vein occurring at the level of superficial vein is higher than at the level of deep veins, due to the fact that superficial blood vessels are surrounded to a lesser extent by the muscle of the body. Treatment of varicose veins. With mild form of varicose vein, the patient usually does not need medical attention. Various folk remedy or simple treatment can help eliminate discomfort. How should varicose vein be treated? To effectively combat varicose vein, it is recommended not only to adhere to treatment, but also to implement preventive measures. In this way, the body will be able to remain healthy and in good shape. Condition. Treatment of varicose vein elastic stockings. Superficial varicose vein, as a rule, do not require special medical attention, but it is still not recommended to ignore this disorder. To eliminate reduced discomfort, your doctor may prescribe wearing elastic stockings to support the veins. These stockings can be purchased at almost every pharmacy or medical supply store. Elastic stockings help the leg muscle direct blood upward, placing additional external pressure on them. The maximum effect can be obtained by wearing such stockings in the morning, before getting out of bed. Keep your leg up and wear stocking evenly. They should be as comfortable as possible. They should be worn all day. Treatment of varicose vein, anti-inflammatory medicine. To reduce swelling and occasional pain, the doctor may also prescribe anti-inflammatory medicine, aspirin or ibuprofen. Treatment of varicose vein laser therapy. Laser therapy helps treat varicose vein in the form of a spider web. Treatment of varicose vein sclerosing therapy. Mild form of superficial varicose vein can be healed using sclerotherapy. This method is based on the introduction of a special chemical into the diseased vein, which glue the walls of a blood vessel so that blood not longer passes through it. Treatment of varicose vein, stripping. For more complex form of varicose vein, the stripping method is used, which is based on surgical removal of a diseased vein. Treatment of varicose vein, essential oils. For varicose vein, you can use various essential oils. The most used for this disease are rosemary oil, cypress oil, chamomile oil. Chamomile and cypress oils can eliminate painful swelling and inflammation. Massage with rosemary oil improve a patient's condition by stimulating capillary circulation. Treatment of varicose vein. Massage. Regularly massaging the problem area can eliminate the discomfort associated with varicose vein. The foot massage starts from the bottom of the legs and ends with the buttocks, along the lymphatic vessel in order to mobilize overloaded body tissue. In addition to massage, reflexology and acupressure can also be used to relieve signs of varicose veins. Treatment of varicose veins, manual therapy. This technique involves not only the treatment of method itself, but also lifestyle change and nutrition. Manual therapy aims to improve blood circulation, thereby eliminating fluid retention in the legs. Treatment of varicose vein, blueberry, hawthorn, and ginkgo biloba. There are many different natural remedies based on herbal ingredients for the treatment of varicose vein. The following medicinal plants are characterized by a strengthening effect on blood vessels: blueberry, common hawthorn, ginkgo biloba. These same plants improve peripheral blood circulation. Treatment of varicose veins, horse chestnut and butcher's broom. Surely, many people suffering from varicose vein are familiar with preparation based on horse chestnut. Ointment and tinctures containing horse chestnut extract, as well as butcher's broom, have a tonic effect on blood vessels, reducing inflammation. Butcher's broom can also be taken as tea. Treatment of varicose vein, witch hazel distillate lotion. For skin irritation as a result of varicose veins, lotion made from witch hazel distillate helps. Treatment of varicose vein, hydrotherapy. Applying cold water, cold shower, or spreading cold water with a sponge on the legs can eliminate the pain and discomfort of superficial varicose vein. Hot and cold bath can stop the development of varicose vein in the legs. To do this, immerse your feet in warm water for 1-2 minutes, then in cold water for half a minute. Repeat this for 15 minutes, alternating warm water and cold water, then cold water with warm water. For a more perfect effect, you can add a few drops of rosemary and chamomile essential oils. Treatment of varicose vein, yoga. Yoga is very effective for varicose vein. Practicing certain positions, plow pose, corpse pose, and standing on the shoulders stimulate blood circulation and drainage of the blood from the lower extremities. Deep breathing exercises practiced during yoga can further eliminate the unpleasant symptoms of varicose veins, filling the blood with even more oxygen. Lifestyle with varicose vein, maintaining physical health and adhering to a healthy diet are considered the main rules in the prevention of varicose vein. Light exercise for 30 minutes every day will not only help you control your weight, but will also strengthen the vein in your legs. You can start the day with a brisk walk or end the day with swimming or cycling. If a patient has already untoured varicose vein, when the control the disease, it is recommended to adhere to a special sport regime under the supervision of a specialist. Nutrition for varicose vein. Nutrition plays a very important role in the treatment of varicose vein. The main tasks solved with the help of nutrition and these are maintaining ideal weight, improving blood circulation. Consuming of such food improve the condition of varicose vein. Cereals, vegetables, fruits. It's also very important to take in as many fluids as possible, especially water. Nutrition for varicose vein. Less fat. Excess fat elements increase water retention, thereby increasing stress on the lower extremities. Subsequently, the condition of varicose vein worsens. In order to reduce the amount of fat in the body and reduce the load of the veins of the leg, it is recommended to consume more fibers and limit the consumption of food high in salt, sugar and fat. How is recommended to eat to reduce the load on the veins of the legs? Some vitamins and bioflavonoids improve the condition of the patients with varicose vein. Daily intake of vitamin C 500 mg and vitamin E 400 international units have a beneficial effect on condition of a vein in the legs. Bioflavonoid increase absorption of vitamin E. For varicose vein, the most suitable substance for this group is rutin. Rutin is found in large quantity in following foods: buckwheat, cherry, blueberry, blackberry, apricots, citruses. Another bioflavonoid, quercetin, is considered very promising in the treatment of varicose veins. Nutrition for varicose vein products that destroy fibrin. It has been observed that consuming certain food can eliminate fibrin deposits that form around varicose vein. The fact is that fibrin is a protein that makes the skin around varicose blood vessel hard and curved. The most effective food for fibrin are pineapple, ginger, garlic, pepper. Pineapple contains the enzyme bromelain, which stimulates the decomposition of fibrin. What can be done at home for varicose vein? To reduce discomfort from varicose vein of the lower extremities to minimum, follow these rules daily. Rest more often, wear elastic stockings, take 1-2 tablets of ibuprofen or aspirin until the painful swelling disappears. How can you reduce blood circulation? How to harm blood circulation less if you keep your leg crossed? If you are used to frequently keeping your legs crossed, try to cross them at the level of your ankles, not your knees. This way, blood circulation will not be affected. Why is it recommended to raise your legs above the level of your head when you have varicose vein? Through the workday, with several short breaks to raise your head. The legs should be raised 10 cm above level of the head. The fact is that in this way the accumulated blood in the legs will return to heart, reducing the load of the veins. Women with varicose vein are advised to avoid high-heeled shoes. To further improve the condition of their feet, women are advised to avoid high-heeled shoes and wear looser, more comfortable clothing. Prevention of a varicose vein It's recommended to stop smoking. If you are a smoker, it is recommended to stop smoking. Many studies have shown that smoking increases blood pressure, thereby increasing the strain of a vein and increasing the risk of varicose veins. Prevention of varicose vein recommendation. If you stand on your feet a lot during the day, lie down and elevate your feet. Try to move your legs as much possible in this position to improve blood circulation and lower blood pressure. Consume food low in fat, sugar and salt. Drink as much as possible water. Take supplements containing vitamin C and A. This substance will not only benefit the veins, but the entire body. Exercise daily. Good physical fitness keeps the vein and surrounding muscle in good condition, improves blood circulation and helps control weight. If you are pregnant, try to sleep on your left side rather than you bake. With the load of a vein over legs is reduced and blood circulation from mother to fetus is improved. Thank you for your attention. This material was prepared based on material from the channel All Scientific. Attention! Before using various treatment and remedy, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.